Health Ministry optimistic Malaysia can beat JP Morgan's projection. Police seize 20 kg of heroin in Taiping. You're watching Updates at Noon with me, Brendan Lipol. The Ministry of Health, MOH, is optimistic of beating JP Morgan's projection on the country's COVID-19 cumulative cases and prove that measures taken by the government to contain the spread of the deadly virus are on the right track. Health Director General Dr. Noor Hisham Abdullah said that based on current trend, the total number of COVID-19 cases in Malaysia was expected to be below 5,000 today.
I think we are certainly doing much better, and perhaps tomorrow we'll know perhaps we are less than 5,000 cases tomorrow. I think I'm just predicting tomorrow. Hopefully, touch wood, that we can bring it down to 5,000 cases, which means our action of MCO 1 and 2 is working.
He said this during his daily briefing on COVID-19 yesterday. JP Morgan Chase & Co. has predicted that Malaysia might see a peak of COVID-19 infection cases by the middle of April at approximately 6,300. However, as of yesterday, Malaysia has only recorded 4,817 cumulative COVID-19 cases. The phase 2 of the MCO, which began on the 1st of April, ends today. And as tomorrow sees it going into the third phase, Dr. Noor Hisham added that the phase 3 of MCO was important for the ministry to further bring down the daily number of COVID-19 cases. The Health Ministry has identified a cluster from a patient who is the person under investigation, PUI, linked to a Bali trip consisting several patients and health personnel from a medical centre in Kuantan, Pahang. To date, 20 people have been identified in the cluster, and of them, 14 are being treated at the Tengku Ampuan Afzan Hospital, HTAA, in Pahang. 2 recovered, 3 in intensive care unit, and 1 died, case 1575. From the cluster, 3 cases involve health personnel.
Case index iaitu kes 4,684. Bagi kluster ini mempunyai sejarah perjalanan ke Bali, Indonesia. Beliau kemudian dia mempunyai kontak rapat dengan kes 1,575 iaitu abang pada kes indeks. Kes ke 1,575 kemudian dia telah menjangkiti 7 kes generasi kedua dan 11 kes generasi ketiga. Terdapat 339 kontak rapat yang telah dikenal pasti dan ujian saringan COVID-19 telah dijalankan, termasuk 202 anggota kesihatan.
Meanwhile, Dr. Noor Hisham said so far 12 recovered COVID-19 patients have come forward to donate their blood plasma for use in treating COVID-19 patients. He said before the Health Ministry took their blood, the former COVID-19 patients were given counselling and had to undergo tests for bacterial infection.
Setakat ni baru dari segi penyidikan awal. Jadi kita masih terlalu awal untuk mengatakan plasma tersebut boleh digunakan untuk pesakit kita. Tetapi kalau ada keperluan penggunaan di peringkat hospital, mereka perlukan plasma dan kita boleh titrate dan concentrate antibody dan sebagainya, mungkin kita akan guna untuk pesakit-pesakit kita yang tahap ke-5 contohnya, yang mana memerlukan bantuan pernafasan di ICU.
He was commenting when asked about the progress of COVID-19 treatment using the blood plasma of patients who have recovered from the infection. Asked about the rapid test kit evaluation by the Health Ministry, Dr. Noor Hisham said, to date, the study conducted has yet to find the accurate and reliable test kit. The Health Ministry is still encouraging various parties, including non-governmental organizations, NGOs, to donate personal protective equipment or PPE for the use of frontline personnel treating COVID-19 patients. Health Director General Datuk Dr. Noor Hisham Abdullah said the supply of PPEs to protect frontline personnel was still needed as it was one of the disposable items used daily. Datuk Dr. Noor Hisham said as of now, the ministry has enough stock to last for at least another 2 weeks. In terms of PPE stock inspections, he said the ministry had a system that can look into the level of supply at the states as well as in hospitals nationwide.
Apa yang kita lihat sekarang ni, kita ada perolehan PPE daripada 3 kaedah. Kaedah pertama ialah melalui perolehan PUKAL, iaitu full procurement untuk semua negeri-negeri di pusat. Yang kedua ialah procurement di peringkat negeri, iaitu perolehan di peringkat negeri. Yang ketiga, ada ramai NGO yang mendermakan PPE kepada kita. Penggunaan PPE ialah setiap hari kita menggunakan PPE.
He added that the use of PPEs has risen by 2 to 10 times more than the normal consumption. Datuk Dr. Noor Hisham also said that more than 1,000 retired nurses have joined the Health Ministry to serve on the front lines to fight against the COVID-19 pandemic. Besides that, he said 54 staff from COVID ward and 65 specialists from the private healthcare sector have joined the ministry. Datuk Dr. Noor Hisham said the ministry welcomed them and that they will be placed based on their expertise.
We welcome them because this is short term. So we work with them closely in short term, but we need to see their expertise as well. What we would like is those who have expertise in terms of experience in working in ICU, working into medical or wards, for example. Then we welcome them, we place them in a certain area. Otherwise, those coming back, for example, if GPs and medical officers, we place them in our clinic, even in a hospital, a non-COVID area, for example.
The Health DG also said his ministry is looking at ways to manage the retirees to accommodate their working hours. On another note, police detained 3 men and seized drugs worth 264,000 ringgit in 2 separate raids in Taiping last Friday. Perak Deputy Police Chief Datuk Goh Boon Keng said the first arrest was made at 6:30 p.m. involving 2 men in their 20s. He said a team conducting Op COVID-19 spotted the suspects in 2 separate cars at Jalan Kuala Kangsar, Taiping.
Dalam kes ini, polis juga telah menyita 2 buah kereta, 1 utas rantai emas berserta loket dan 1 bentuk cincin emas. Jumlah nilai harta yang disita adalah dianggarkan sebanyak RM89,900.
Briefing reporters yesterday, he said an inspection on a Toyota Vios car found 20.02 kg of heroin hidden under the floor mats on the front passenger side. Datuk Goh said further interrogation on the duo led to the arrest of another man in his 20s at Taman Sri Kota. He said all the suspects were remanded for 7 days until Friday and that the case was being investigated under Section 39B of the Dangerous Drugs Act 1952. The suspects were also investigated under Regulation 11, Subsection 1 of the Prevention and Control of Infectious Diseases 2020. In Kanga Perlis, a man was arrested and remanded for a day to assist the police to complete investigation paper for obstructing civil servant from carrying out duties. The suspect allegedly used abusive words on a policeman who was manning a roadblock put up to enforce the Movement Control Order MCO.
Beliau telah melakukan 4 kesalahan yang telah kita kenal pasti. Kesalahan pertama adalah menghalang pejabat awam daripada menjalankan tugas di bawah Seksyen 186 Kanun Keseksaan, dan juga beliau tidak membawa kad pengenalan semasa kita menahan beliau, iaitu kesalahan di bawah Seksyen 25 bracket 1 bracket N Akta Pendaftaran Negara. Dan yang ketiga juga kita siasat beliau di bawah peraturan 11/1 iaitu akta yang kita sedang kuat kuasa sekarang, akta penyakit yang kita sedang kuat kuasa sekarang. Dan lagi satu iaitu hasil daripada siasatan kita mendapati beliau adalah positif dadah jenis MERS.
Besides that, the suspect also has a previous criminal record. The Phase 2 of the Movement Control Order MCO, which began on the 1st of April, ends today. The third phase of the MCO, which begins tomorrow, will be enforced until the 28th of April. In the meantime, the Attorney General's Chambers AGC has gazetted the prevention and control of infectious diseases, measures within the local infected areas, extension of operation regulations 2020 for the second phase of the Movement Control Order MCO from the 1st of April to 14th April. The AGC in the statement said for the third phase, the respective laws are being prepared. The AGC was responding to a statement by lawyer Datuk N. Sivanathan, which said new gazette needed to enforce phase 3 of MCO, says Bar, published by a portal. According to the article, the AGC had gazetted the laws for the first phase of the MCO from 18 March until 31st March, but it did not do the same for the second and the third phases. The AGC, in its statement, listed 4 laws to be enforced for the period of 1st till 14th April. EPF extends April 2020 employers' contribution payment dates. The Employees Provident Fund, or EPF, has extended the date for employers to remit their mandatory contribution for the salary months of March 2020. Now, the decision was made in light of the ongoing Movement Control Order, MCO, and its subsequent impact on business activities in the country. EPF in a statement said that the March contribution has been extended from 15 April to 24th April. The contribution payments can be made on the EPF website via e-Charuman in the I account employer portal. Contribution payments can also be made via internet banking or by visiting the counter of appointed banks. The Perak State Government will introduce a drive-through Ramadan Bazaar known as the Smart IFTA at Perak in suitable districts in the state. The drive-through Ramadan Bazaars, however, will only be allowed if the third phase of MCO, which begins tomorrow, ends on the 28th of April. Chairman of the State Housing, Local Government, Public Transportation and Tourism Committee, Datuk Noli Ashilin Muhammad Radzi, said the concept allows the public to place their orders online either to have their purchases sent to their homes or self-pickup. Traders who are interested in the online service must register with the local authorities in their areas, and this registration is free of charge. Through Smart IFTA at Perak, the food sold at the bazaars will be cooked and packed, and these bazaars will operate from 3 p.m. until 6 p.m.
Jadi apabila kita buat secara drive-thru, kita berpendapat bahawasanya ianya adalah selamatlah daripada segi interaksi itu, tidaklah orang berkunjung ramai-ramai mengikut kereta masing-masing, seorang dan kereta, dan dia akan bertukar, orang kata transaksi hanya akan bertukar mengikut drive-thru tersebut sahaja.
The Smart IFTA at Perak was intended to help the traders to generate income throughout the months of Ramadan. The Sultan of Selangor, Sultan Sharafuddin Idris Shah, has decreed that the suspension of Friday and congregational prayers, as well as religious lectures at all mosques, surau and musola, prayer rooms in the state, be extended until 31st May to contain the spread of COVID-19. Private Secretary to the Sultan, Datuk Muhammad Munir Bani, in a statement today, however, said a new directive would be issued should the COVID-19 outbreak could be resolved earlier than the date. The decision to extend the suspension was made during a special meeting between the Selangor Islamic Religious Council and the Selangor Islamic Religious Department held yesterday. The postponed Friday prayers must be replaced with Zohor prayers, while the Tarawih prayers during this Ramadan should be performed at home. Datuk Muhammad Munir said Sultan Sharafuddin also expressed his concern that the 6.5 million people residing in Selangor could expose themselves to the virus if the preventive measures were not taken seriously. The ruler also advised the people to stay at home while adopting good personal hygiene and practicing social distancing, adding that all must also adhere to guidelines issued by the Health Ministry. With that, we conclude today's updates at noon. In our top story, Health Ministry optimistic Malaysia can beat JP Morgan's projection. Join us again at 7 this evening for news on 2. Till then, thank you so much for watching. I'm Brennan Lepal. Stay safe.